Hello today. It's Jack Hockley back again. So today I'm going to be looking down at my notes quite a bit. This is, I believe, part 4 of the endocannabinoid system. It has taken the state of knowledge and research on it have changed so much. I bit off a lot more than I thought I was going to. So today we're going to be talking about how half the systems are affected. Next time it'll be, today we're mainly talking about autoimmune. But some of the studies coming out are showing some very interesting things. It's very clear to me now why they need doctors to be specifically certified to prescribe cannabis. Though they may need to divide it up eventually into simple, such as you have a broken arm, get this, versus complex patients who have IBD or something like that. By that I mean inflammatory bowel disease, which I'm sure many people are familiar with, unfortunately. So basically, in an autoimmune disease, your body, your immune system, it attacks itself, and it's because of something just going wrong, whether it's the encoding, whatever, it doesn't matter, genetic. Your body's attacking itself. What they found is that cannabinoids can actually help with immunomodulation. I've read multiple times through literature that it can cause suppression in these states where the autoimmune disease is basically causing your immune system to go out of control, which is chaos. So it helps suppress that. But it is also unknown whether or not it modulates the immune system or just suppresses it. So what I mean by that is if there's too little of it, they don't know if it modulates it back to baseline or whether it just suppresses. I'm guessing it would bring it back to baseline, but that's just educated hunch based on knowing about atypical other types of drugs. It's what they do, they set a rhythm. It could be that. Not saying it is. Once again, no research on that. So with immune suppression, it downregulates cytokines as well. Cytokines cause inflammation. Inflammation causes pain. In a lot of the immune dysregulation that happens, that can play a big factor. And cause you, like in rheumatoid arthritis, that's a lot of pain, and it's inflammation. It also causes T cells, which are one of your body's main constituents of the immune system, and macrophages, which eat other cells. So it down regulates them and helps destroy them, which helps the immune system in general because it's out of whack. You want to get that thing under control. And this is for all kinds of immune problems. Like I'm talking about from, what's it called? I can't think of the name of the disease right now. No, it's not endocarditis. Give me 1 second. Lupus. There, that would be a perfect example. Lupus. So that's systemic, and I mean that can happen in any part of your body at any time. It can be attacked basically by yourself. So lupus, great example of how it can help downregulate that hyperactivity and hopefully help relieve symptoms. Uh, the endocannabinoid system, fascinatingly enough, has also been correlated with the blood-brain barrier and modulating it. So, blood-brain barrier, it helps keep a lot of things out of your brain that you don't want in there. And if it gets dysregulated, then a lot more stuff is going in your brain than is meant to be. And you don't need that. What you need is a perfectly balanced brain, getting all the sugar it needs, getting whatever else. You don't need either too much or too little of anything. Everything is kept very regulated inside the central nervous system, which is the brain's spinal cord. So, interestingly enough, they're actually looking at this though, and they're looking at making drugs that would be able to cross over the blood-brain barrier because of the channels that marijuana creates. And even more interestingly, they're looking at it also modulating schizophrenia and epilepsy and a whole whack of other things. But the schizophrenia thing alone, they need to do a lot more studies on, and I think I touched on this on a previous video, where the thinking about it might be wrong. I mean, 90% of people who have schizophrenia use marijuana. Is that because it's making them worse? Or is it making them better? It's the same with nicotine. 90% use it. Is it making them worse? Or is it helping something? But basically, that really cool thing to me was the fact that it creates these new channels, and it allows certain drugs to get through that never would have been able to get through before. That's unreal. That's an unreal thing to think about. Like, think about, we've been ignoring this body system, and it's everywhere. It's everywhere in our bodies, these receptors. And we've ignored it for 100 years because it was illegal. Stupidest thing we could do. So, in addition to how it modulates the blood-brain barrier, and it's been correlated with shutting out, we'll just call it plaque for now. So when you get Alzheimer's, one of the most common ways is there's a buildup of A beta, I think it's called, plaques. Now, it modulates the brain to allow less of these plaques in, which for people who have, Alzheimer's, let's say they're in the early stages, this might be a viable treatment option to help delay the progression of the disease immensely. But like I said, this is early research. It doesn't mean anything yet. Well, it does mean something, but it doesn't mean anything proof positive. It's not, 100%. It's not what it is. So, yeah. Yep. And then MS. So if we move on to MS, then what we find is that it actually helps with the pain, with muscle spasticity, so spasms. I think I explained that in an earlier video. And toxicity, general toxicity, it helps with. So there's a growing body of evidence. Well, it shows cannabis may be better at accomplishing this with fewer side effects than the standard first-line treatment. And those are early studies. But think about that. That means that the first line treatment that you're getting right now for MS, if you have it, multiple sclerosis, um, then cannabis might actually just be better. But you still need the right type, which is why we need these doctors specially trained in it. It needs to be made widely available on the internet. Um, needs to be accessible by any medical professional, and it needs to be not cost prohibitive, because really everyone should know about this stuff, from the bottom of the medical system to the very top. They should all know about it. It's important information. So, another interesting thing, variation in a gene, which is part of the code for endocannabinoid receptors, may put people at risk for autoimmune disorders. So you might have the genetic coding where something went wrong in your endocannabinoid receptors, and it puts you at risk for autoimmune disorders. This further links the immune system and endocannabinoid system and pulls them further together. And we'll see more and more of that, I predict, where as we start connecting the pieces. It's always about the connections between everything. And we'll see more and more studies come out on that, more and more on this. I mean, the article I'm using this mostly, 2021. It's already 5 years ago. That means 5 more years of research have been done. This was just the most comprehensive article that I could find at the time. So, rheumatoid arthritis, as I was talking about before. So, cool stuff with that. Not only immunomodulatory, which you need, as it's the immune system attacking your cartilage and all that. And then also the analgesic, so it's a painkiller. It kills any type of pain. It's like a nerve pain agent. So pregabalin or gabapentin, they will help with pretty much any type of pain because it blocks it at the nerve. Cannabis, same deal. Works on pretty much every type of pain. So I don't know why we treat it so low when it's such an important part. It should be such an important part of medicine. We can even take extracts from it. We can take whatever. They're learning more and more about all of these chemicals that affect the endocannabinoid system and making up crazy long names for them. There's a lot of just initials rather than writing out the whole thing. And it might even increase the synovial fluid producing cells in some of those rheumatoid arthritis patients. More synovial fluid means better movement, gentler movement, easier. It's a good thing. And but that's early. This is all early. The last bit to talk about. So the GI system, it has an abundance of endocannabinoid receptors. For people with IBS, marijuana might be a godsend. I don't like using that term, but okay, it might help a lot. Unfortunately, right now it's mostly all of anecdotal evidence and a few trials. An anecdotal evidence is the weakest type of evidence. It's just people saying, "Hey, it worked for me." That's their story. But the stories start to stack up, and eventually, it's got to be studied rigorously, and that's what'll happen. And I'm hoping that within the next 10 years or so, we'll see some novel treatments for IBS. Because, I mean, anyone with Crohn's or ulcerative colitis out there knows how bad it is. I remember one time I was in the hospital and I was seeing this patient, she's like a 17-year-old girl. She had ulcerative colitis. She was in the hospital every few months. I think they had to do surgery on her. Just that's at 17. Now, if a 17-year-old can get relief from marijuana, say give it to them. Keep them out of the hospital, keep them healthier, keep them better, keep them at home with their hopefully loving parents. Um, Anyways, this has been a long one. The next one will probably be a long one too. I was shooting for 5 minutes. Spent hours instead poring over this thing, trying to compress it all down. and it got away from me. But yeah, always talk to your doctor before you try anything medically. And remember that only some doctors are certified to distribute cannabis or talk about it. I'm a nurse, so it's kind of a gray area, and I'm not really telling you to do anything. I'm just giving you some facts or what the current state of the game is with marijuana and medicine in general. My next one should be the last one, but we'll see what happens. Um, and that's 16 minutes. That's too long. Sorry for not being briefer. I should have cut this up into more. Anyways, Jack Hawklight signing off. Have a good one.